To Let's Have Lunch. We're in the episodes 30 somewhere, and we are back in action. We're super excited to be working and seeing you all, and hopefully those who have been to our office already recognize a few of the changes. The doors are open, we've got masks on, we've got plenty of hand sanitizer, and we're just having a good time taking care of you. So thank you for coming back. For any of you who are unaware, Studio A has a $9.99 per unit Botox offer through the month. So feel free to take advantage of that. That's pretty exciting. We're celebrating our 20th year anniversary, and we're just happy that the doors are literally open. Today we are going to talk about PicoSure, most specifically tattoo removal. And let me give you a little bit of a history. Not that it matters. I do not have any tattoos. I think all the ladies with us today do have tattoos, but I don't think they can show them to you. But besides that, tattoos we are part of our culture now. For me, growing up and personally, I don't know. I don't know what I would write that I would want there permanently, but I do understand that many patients are very thoughtful. If they decide they want a tattoo, they'll wait a year. Some of the tattoos, when we start inquiring about why people have them, they're from, they'll tell a story about their grandfather, in the war, and, that's why they have this tattoo on. Some people just like the art, and some people, unfortunately, get drunk and have tattoo regret when they have a tattoo done. But so we explored for a while. Karen Lynch and myself, we were headed out on the streets to the tattoo parlors and really to kind of understand more about tattoos. I'll tell you what I learned. I learned that there's a real, besides the artistry, which is really incredible, I was really impressed by vegan dyes, by really the guidelines that the higher-end tattoo parlors, most of which we visited, had followed. And what we discovered is that even if your body's covered with tattoos, what happens is some of the art may not be great, or people want cover-ups. So our job then in those situations wasn't to remove the tattoo completely. It was to remove the tattoo enough that other art could be performed, could be done over it. I met a lot of tattoo artists. Karen is out there, on the streets. Karen, show us your tattoo.
I can't.
Oh, I can't. Okay, all right. I didn't know. I thought it said, "I love my job," is what I thought it said. But
big butterfly.
Okay, that's what it was. We do see a lot of butterflies. So, but anyway, so with this, there was some real intent, I guess, in terms of understanding the need for this. And this came about because of the Pico technology, which Karen will talk about in a moment. And so we've been in the tattoo business. We've done some things that have been deemed questionable. I don't mean the way we're doing them, but we did for a while. There were some ex-felons who wanted to get back out off the street, out of prison, who were finding themselves with jobs at the stadium, cleaning seats and doing whatever. They had tattoos on their face or on their necks, and some of these, mostly young men, I think, that we treated, had come in, and so we were trying to provide a service. We were greeted with, some people didn't like that for various reasons, maybe because of their past history, but these weren't criminally violent people that we were treating. They were people mostly for drug convictions. Anyway, we wanted to help. We thought we were helping. But we've done a lot with tattoos. I'm going to turn it over to Karen Whitney. I will mention, let me just tell you real quickly, Karen, like with sclerotherapy, has had an extensive background with the Q-switch laser. She'll talk about the technologies doing tattoo removal in the past, and so she'll talk to you about why this technology is so much better, and we'll go from there. So I'm going to turn it over to you, Karen.
Okay, great, thank you. So, tattoos, wow, it's such a fascinating thing to see what people have tattooed on their bodies, and the meaning. Some of them are just, like you say, they had a big night out, something frivolous, but so often it's so thoughtful and emotional, and still perhaps relevant, but maybe the tattoo doesn't need to be there anymore. So we see every reason in the world for people to get their tattoos removed. And when I started with Dr. Mendelsohn at Advanced, we talked about he might purchase a tattoo removal laser. I wasn't very excited about it because 20 plus years previously, I had worked with the standard Q-switch YAG laser doing tattoo removal. And at the time, treating some patients with pretty remarkable, colorful tattoos. And the process was that we would have to injection numb the entire area, which was painful and very time consuming, and then treat it with the laser, which also was very still painful and time consuming. Often they would have some bleeding after the treatment. It took many weeks to heal. And I had these patients that I had treated 4, 5, 6, 7 times with very minimal fading. So it was such a not effective, such an ineffective treatment that I really wasn't excited. Then PicoSure laser came onto the scene, and the PicoSure laser really did make a very significant difference in the practice of tattoo removal. So let me explain the difference between the two. First of all, when you get a tattoo, the tattoo artist is placing pigment in the deeper layers of your skin. So you have the epidermis, which is what we see, touch, feel. It gets scraped if you skin your knee. The dermis is the living part of your skin underneath, so the part that can bleed. And then if you take away all the dermis, that's when you have a 3rd-degree burn and you need skin put back on. So when we get a tattoo, when you get a tattoo, that ink is placed in that living layer of skin using needles. And depending on where you're going, you might get a vegetable-based ink. There are metallic-based inks. There quite a variety of components can go into what is actually causing the color and trying to make it stay longer, because everybody wants their tattoo to be permanent until you don't. So large particles of ink are placed in the skin, and your body is not able to remove those particles. So if you have a tiny particle, the body thinks it's a foreign body, white blood cells come in, carry it away. But these large pieces of ink just sit there. And that's why tattoos don't go away. They might fade from UV light. They might fade if some smaller particles are carried away, or as the ink settles deeper into the dermis. But for the most part, the bulk of that tattoo is sitting there. So lasers produce a wavelength of light, and different wavelengths of light are absorbed by different colors. So if you're using a Q-switch laser, for example, that black absorbs that very well. So the laser light hits the skin, the ink absorbs the energy of the light, and it breaks it into smaller pieces. So now your body's able to come in and clean it up and take it away. So that's basically how a laser works. But obviously there's different levels of effectiveness there. With the Q-switch laser, that wavelength, when it interacts with the skin and the ink, it's a thermal reaction, meaning heat is actually breaking those particles of ink apart. That heat makes it more painful, causes more skin damage, and also gives you a little bit greater risk for scarring. So PicoSure laser came along, and the Pico claim to fame is that it fires 1 trillion times a second, which of course you can't fathom. But the impact is that when the Pico laser energy hits the ink, it's going so fast, it's mechanical instead of thermal. So you have a different way of breaking up the ink with these different lasers, and that's what differentiates them. So wavelength as well as the speed that the light is produced. So the Pico lasers fire faster. They have a mechanical impact on the ink, which is more effective at breaking it up with less tissue damage. And while it still hurts, it's less painful overall than the Q-switch. So let's say you have a tattoo, you've decided you finally want to get rid of it. You might be thinking, well, I don't really want to pay for laser. It doesn't sound like a great deal. Can I use a cream? If you go online, there are all kinds of tattoo fading creams. None of them are FDA approved. The way they work is that they either chemically or mechanically exfoliate the skin to get rid of some of that epidermal layer. And then they're putting a chemical to break up that ink, trying to break it into particles. you can imagine the difficulty here from what you've just learned about where the ink is and what you need to do to get rid of it. So the creams are notoriously ineffective unless you have something very light and very superficial where you might be able to see some fading. So the risk for scarring, infection, skin damage with those topical creams is pretty good. I would say don't waste your time and your money. We've seen people try to burn off their tattoos. That's effective, but then you're left with scarring. In the old days, a surgeon would cut the skin out. Well, that's fine if you have a very narrow tattoo in a place where you can afford to lose some skin. But of course, you're still going to be left with a scar. So if you decide, I've got this tattoo, I really don't want it anymore, we're going to talk about what color is it, how old is it, how dark and dense is it, how large is it, what area of the body is it placed on. Because tattoos that are placed closer to the heart in your main circulation are going to respond better than a tattoo on a finger, a feet, a leg, because you're farther away from adequate blood flow, the highest blood flow, and the easiest lymphatic clearance. So location makes a difference as well. When we treat you, so patients always ask, how many treatments is it going to take? And because of all those reasons, it's very hard for me to give you an accurate answer. I estimate 7 to 10, but if I see something very light, I'm going to estimate more like 2 to 6. You know, I've seen shadowing tattoo, just a light shadowing, go away with 1 treatment. I've also seen the darkest of outlines and the densest, often it's tribal, take 20 treatments. So there's a huge range there, even with the Pico laser. But the process is that you would come in, we've either given you a topical numbing cream or we apply it in the office. And the way you use a topical numbing cream is you start with clean skin, you put a kind of a thick layer, but thicker than suntan lotion, but not so thick you can see a white glob. Cover it with saran wrap or plastic wrap to hold it in place and keep it from drying up. And you can use that for up to an hour. Really large areas, we can't use that much numbing because we don't want to worry about toxicity. So in that case, we might break up. Like if you had a whole chest, we would probably break it up into treatment areas. But we wipe the numbing cream off. We're going to blow cold air on the skin while I treat you. And the laser light is pulsed. It pulses very fast, like 10 times a second is the rate that the light is hitting your skin. And I've got a couple pictures you'll see, and one of those pictures will show what does your tattoo look like immediately after I treat you. Because what you're going to see is something called frosting. And frosting is a whitish appearance to the skin that almost looks like we've faded your tattoo miraculously. Let's see, it's not that one, although this is, you know, there we are. In the upper right-hand corner and the upper left hand, you can see a tattoo treatment immediately afterwards and one in place. And what you're seeing there is frosting, where the skin bubbles in reaction to the energy released as that, as the ink particles break apart. And that white appearance will last anywhere from 5 to 10 minutes, and then it goes back to looking a little bit red and swollen. When you look at your tattoo that night or the next day, it's going to look like the lower left hand. You may or may not have that kind of blistering. Some patients always blister. It's how their skin reacts. Some patients never blister. Very rarely will you have bleeding or open skin. That's common with the Q-switch, but not with the Pico. So you can see on that lower one that maybe it's where the ink was the darkest, maybe it was a different color, but that kind of blistered appearance is common. Now, when I treat you, it feels like a hot rubber band snapping. It goes very fast. We're blowing cold air on, we're trying to distract you, we're taking a break if you want it, if you prefer. It's not a fun process. And literally some patients will sit there like I'm not really doing much of anything. And for other patients, it's really painful. So it depends a bit on your pain tolerance and also where the tattoo is located and how large it is. Also, as we start out, the ink is very dense. More energy is being absorbed than when we're at the end and we're just cleaning up the leftover particles. As I'm treating you with each session, I'm adjusting the energy according to the density and the darkness of your ink, and also the size. So I can start out stronger with a smaller outline of a tattoo than I would with a larger solid area of tattooing. So I'm adjusting the energy with each treatment to suit what's going on with your tattoo at the time. Because each time I see you, it's a slightly different tattoo because of the amount of fading that's occurred. After treatment, you're going to protect it with either Aquaphor or Vaseline and a non-stick bandage. And you're usually keeping it protected for a week to 10 days. What we want to do is protect any blistered skin. It is okay to pop the blister. And we don't want you to get crusty or scabby because that increases the risk for scarring. While these almost never get infected, they can have some redishness around the treated area. That's increased blood flow to help with the healing process. You don't go swimming or in a hot tub because we don't want to risk infection, and you don't want a lot of friction on the area. So sometimes patients will be going on vacation, or they're going to be going hiking or doing something that they don't want to worry about their healing tattoo. So we just space your treatment to account for that. Generally, we're going to treat you every 6 to 8 weeks as we start treating you to get things rolling. As your treatment progresses and we're targeting the deeper layers, I find that we do better to space the treatments a little bit farther apart because it seems to take longer for your body to absorb those residual particles of ink. Nothing bad happens if we treat you and you can't come back for 3 months. Your body's still probably going to be continuing the cleaning up process. It just slows down the rate of overall time that it takes to fade your tattoo. So it's not unusual, we'll get an inquiry from somebody who wants to join the service or the police force. Sometimes, whatever your occupation might be, you're not allowed to have tattoos that are visible. So they're in a hurry to get things faded as quickly as possible. Those patients we treat at 6-week intervals and just get it done as fast as we can. Whereas other times it's somebody who's in no hurry whatsoever, and maybe they're budgeting for their treatments. And so we'll see them twice a year. And one of the nice things about this process is either of those is perfectly fine. Let's see, pricing is based on the size of your tattoo. We typically start pricing at $200 per treatment, and it's based on the square inches. And so if you were to inquire about a tattoo, we always ask you to send me a photo so that I can take a look at it and get an idea of what we're dealing with. And these are two really beautiful outcomes and common areas for tattoos. The back of the neck and on shoulders are very common. I would say that the upper tattoo probably had some fairly dense outlining and then very light shading. So that light shading probably went away with one treatment, whereas that denser outline, I would guess, probably took about 7 sessions to get that beautiful result of really nothing visible. The script on the lower probably took about 5 treatments. I would guess 4 to 5 treatments. It's not very dark. You can see there's some fading. You don't see the intensely defined outline like in the shamrock up above. So each tattoo really is as unique as you would guess it to be, based on who did it, what colors. Colors are a frequent question. It's been typical and continues to be that plain black ink is probably the easiest to fade, all things considered, but knowing that black is sometimes very dense. Green, blues do very well with the Pico. Most purples fade well. If you get into red, sometimes the Pico is not the best tattoo and you laser, and we might need to refer you to finish a red So we would talk about that ahead of time. White is very difficult to get rid of because it doesn't absorb the light. Yellow tends to break down slowly, but yellow and orange also don't absorb the laser light very well. So there's a lot of factors that go into the decision to get rid of a tattoo. And I think most people just say, yeah, I'm over it. It doesn't suit me. I don't like it because I don't want my kids to see this tattoo. Change of partners, any multiple factors. And sometimes someone's coming in and they'll say, hey, I love my full sleeve, but I don't like these roses in it anymore. And in that case, we can carefully just remove the area that they don't like. Often that'll get covered up, so it doesn't have to be 100% eliminated. I get questions about scarring, and scarring is unusual. But what you can expect is that if you say you have a tattoo on your upper arm, you're outside a lot, you have residual background tan of that arm, meaning that even in the winter, your arm looks tan compared to a sun-covered area. When we do the tattoo removal, some of your tan pigment is probably going to fade along with it, leaving kind of a ghosting effect. Usually your body will fill in the melanin on its own, but that can take a while. So this is also something that we would discuss ahead of time. Actual scarring, meaning textural changes of the skin, are unusual from a laser, unless it's incorrectly done and someone uses way too much energy to cause tissue damage. But recognize that if you had a scar under your tattoo or when your tattoo was applied, scarring can occur. Karen or Dr. Mendelson, what questions about tattoos have I left unanswered?
Oh, you covered a lot. I would say specifically, you did cover that a little bit, and just colors. And I think just to emphasize, while the PicoSure, at least the wavelength that we're using mainly, is really great for most colors. Red, it will clear somewhat, but if it's a full red tattoo, that is where we have a little bit more challenge with that. So I just want to point that out. But yeah, I'm not sure. Hope, Karen, any other questions?
Let's see. One thing I'm hearing with all of the microblading and tattoo emphasis on eyebrows, we get a lot of inquiries that people don't like their end result. I can adjust or treat an eyebrow that's been microbladed. It's tricky because my spot size is a little circle, and it's going from 3 millimeters down to 2 millimeters, so it's a little spot. So if you want me to adjust a teeny tiny little something on your eyebrow, it can be very tricky. So we can do it. I take a look at it. It's always, again, hard to tell how many treatments it will take, but it's something, if you have a concern about, by all means send me a picture and I'll talk to you about it.
That's a very good point.
Yeah.
I was going to say, only because Hope is with us and she has to contribute somehow, talking about skin. I know we've talked about this a little before, but Hope, maybe you could say a few words about Pico Focus Array and how we use it for pigmentation for some other issues. I think you're on mute. Hope, can you hear me? You're on mute.
Sorry. Can you hear me now?
Yes, yes.
Right. So I was saying, Karen, that was a great synopsis on the tattoo. We can also use the same machine with a different handpiece. So the handpieces are interchangeable depending on what we're treating with the PicoSure laser. And there is a handpiece called a focus array. And so what that does is it basically takes that laser light beam that Karen was describing, and it bursts it to a lot of different pulses. So basically, I think it's 1 trillion pulses each time that we fire the laser. And that is considered a mechanical injury. Like Karen was mentioning, it's not thermal. So it's a mechanical injury. And that means that it's much more safe to use with various skin tones in treatment of pigmentation. So the focus array targets the melanin, the pigment in the skin, And so we can use that to help with brown spots. I love it for melasma. Melasma is an inflammatory condition and it can get flared up by heat. As anyone out there with melasma knows, it's very sensitive to heat. So you have to be careful with what you treat it with. And the PicoSure focus array is a safe way an effective way to treat that. Typically, we do recommend about 3 to 5 treatments, depending on the type of pigmentation we're treating, depending on, you know, just patient response. Some people respond better to a laser than others. It's just what happens. And so we'll start with 3 and do those treatments about 1 month apart. And you should slowly see a reduction. Usually I don't see too much improvement after the first with the brown. It seems to be that second and third treatment where you really see the brown spots and melasma reducing. So we use that a lot, and I've been very impressed with the PicoSure Focus Array. It does a great job with pigmentation. It also does some facial rejuvenation, so it does stimulate some collagen as well, which doesn't hurt anything. So we love that treatment.
Great, thank you. Yeah, so we've got a lot of ways to treat pigmentation, and I think the highlight here is that because it's so fast, as both Karen and Hope were talking about, we can treat skin types. I guess is a huge benefit there. So, Karen, that was an awesome overview. Thank you very much. Appreciate that. Hope, thank you for sharing, and Karen, just thanks always for just being you. You know, next time we'll take a look at that tattoo, but. Anyway, all right, so we are back. We're going to continue. We're going to try to do some live things throughout the week here in terms of treatments. And so stand by for that. And just a reminder, $9.99 Botox per unit for Botox through the month of May. Anyway, thank you all for hanging out with us for the past 30-something days for Let's Have Lunch. We will see you back soon. Thank you. Bye.